ERs check for immigration status before treating a dying patient?
That's probably not a question for me to answer. I think that's a question for healthcare professionals and legal experts to answer.
I understand why I'm asking you, because Republicans have been saying that Democrats want to give benefits to undocumented immigrants, even though it's against the law for them to get these benefits. I know
Let me ask you, do you think that illegal aliens should receive Medicaid benefits? Medicaid benefits that go to the most vulnerable people in our country. That Medicaid benefits that were designed to help low-income families and Americans in our country. And what the Biden administration did, Gabe, is they allowed tens of millions of illegal aliens from all over the world to come into our country, yes, and they paroled them into the system. And you cover immigration, and you know well, it was a complete abuse of our immigration system. And they slapped a Band-Aid on these illegals. They called it temporary protective status. And then they allowed those illegals from all over the world to get free benefits. And you know who would like free benefits? Hardworking Americans who work their butts off every day, who are living paycheck to paycheck because of the Biden-induced inflation crisis. And there were higher wait times at hospitals under the Biden administration. We saw these illegals committing crimes all over our country, and they're getting things for free. That is fundamentally unfair, and this administration is not going to support it.
Should ERs, if a person comes in with a stroke or a bullet wound or is bleeding out, should they ask for immigration status before treating that person?
Gabe, I don't speak for emergency rooms across the country. I speak for the President of the United States, and that's what he believes on this policy.
To make somewhere between 11 and 16 million people lose their health care. I know you said on a Sunday morning show no one will lose coverage as a result of this bill. Is that still your standing?
Which one of those would you like me to take?
The one I just asked. I'll ask it again. I'm sorry if I wasn't
clear. The bill
clear.
does not lead to less coverage for Medicaid beneficiaries. It has improper payments, and it leads to the fact that people who are ineligible because they're illegal aliens or because they are unwilling to
do not
work.
get federal dollars from Medicaid, correct?
That's not true. They get them in many different states, including California.
Federal dollars?
Federal dollars using
they get
provider.
State dollars. State can provide it. Are there any federal dollars?
Congressman,
how many federal dollars then, since you're the expert, how many federal dollars go to funding illegal aliens getting Medicaid?
Congressman, because of the money laundering.
It's a number. It's a question. It's a number. How many dollars go to illegal aliens, federal dollars for Medicaid? It's a simple question.
It is not actually a simple question because Congress.
All your secretaries have a hard time with simple questions lately. I got to tell you, it is a simple.
But
you were saying that that's true, so we will. If you can get back to us with that amount, how's that sound? How much federal dollars?
I'm happy to get back to you about how the bill works and getting rid of the money laundering schemes that
a lot of people disagree with you.
Republicans love to blame poor people for Medicaid fraud, but the reality is the majority of Medicaid fraud comes directly from private insurance companies.
Do I just speak for everyone in this room or everybody in Texas? What the heck is going on? We are all just trying to do our best to, take care of our kids and pay the insurance and run the errands and do all the things that we have to do. And we're paying into insurance and we expect to receive good medical care. And it's a constant runaround. It's a constant hamster wheel. Texans continue to be sick. We don't know that everybody points the finger in a circular firing squad. And then now we're up here talking to a company who has received millions, billions of dollars in taxpayer funds through Medicaid contracts, who have used that money to then hire private investigators to follow around patients and legislators that are asking questions about what the heck is going on. It just shouldn't be this hard. It's ridiculous. And I know, well, I would say you're being put on the spot here, except for you're not. You knew this was coming, or you knew this was happening. Well, you were the one that was asking for those private investigations.
Yeah.
How are we supposed to sit up here and believe what you are telling us, to make any change, to put any stock in what you are saying? It's exhausting. You don't think it's exhausting as a legislator to run for this office thinking that you're going to make your constituents' lives better and be met with this crap? This is insane that the state government committee has to sit through this, that this is the kind of issues that we're dealing with because we don't have companies who take responsibility for the taxpayer money that they are awarded and do right by the Texans who have paid for it. When are you going to tell us that you're going to do better? You're going to change. And instead you come here and complain that you didn't get a procurement? What kind of grand miscalculation was that?
Yeah, I don't have a response, sorry.
Okay.
Yeah.
Well, I have a couple follow-up questions then. So going back to the private investigation, we've talked about the legislators. Has your MCO ever tasked a private investigator or firm to look into the background, financial or personal records of any state employee?
I'm trying to think, not that I'm aware of, but I can't say for sure.
Do you
I
think
believe
that-
those, like I said, I think those were from several years ago. We have not used that practice since then. So.
How are we supposed, why would we believe that?
I don't know.
Okay.
I'm just saying that.
Have you ever contacted the Office of the Inspector General during an investigation to assert that the investigators should not be asking questions of your employees?
Not that I can think of. We cooperate fully with any audit from the OIG or any regulatory audit.
Have you ever obtained whistleblower information from an HHSC employee and then used that information to initiate litigation against the whistleblower?
No.
Okay, I look forward to our further discussion.
It is one of the biggest criminal investigations of an American corporation ever.
We're executing a search warrant.
In the past few months, hundreds of federal agents have raided at least 70 of Columbia's hospitals and offices in 7 states.
Rick Scott promised explosive growth to shareholders, but to insiders, Rick Scott could be ruthless.
They seem to care more about profits than medicine.
Good old-fashioned fraud, lying for money.
Over the last decade, Columbia has made its stockholders and executives rich.
The company cheated the Medicare program, and they knew what they were doing.
Regularly filing false Medicare reports and overcharging the government.
Charging the government for everything from Kentucky Derby tickets to country club memberships.
False claims submitted to the government year after year over the course of hundreds of hospitals. Their promotions depended on it. Their bonuses depended on it.
For-profit hospital chain HCA, formerly called Columbia HCA, will plead guilty to criminal conduct.
$745 million to settle charges of fraud in Medicare billing.
Rick Scott and 5 other top corporate executives have resigned, and federal investigators told ABC News today that Scott is now considered a prime target of the investigation.
There's absolutely no benefit to giving free health care to undocumented immigrants. I mean, unless you qualify for Medicaid and Medicare in this country, then you don't have access to it and you got to pay out of pocket most likely, unless you work for a company that provides you with good benefits programs. Democrats don't want undocumented immigrants to have free health insurance. That doesn't make money for the private health insurance companies that fund their pockets, for the pharmaceutical industries that literally fund their entire careers. We have the shutdown because Republicans want to increase our premium costs. It's really not more complicated than that. They already passed a big, beautiful bill that's going to take health care away from 15 million people just through Medicaid, on top of everything else that they've done, all the other programs that they've cut, all the people that they fired, the list goes on to how these people are clearly not concerned with Americans' access to health care. But the Republican Party's lazy. And I mean, they basically just full-fledged fascists now. They don't have to tell the truth. They don't care to tell the truth. They're just going to continue to wage war with the court system so that they can get away with whatever they want. Now, luckily, judges around the country are striking many of the things down that they're attempting to do, but they ain't striking down all of it. But nah, man. Undocumented immigrants don't have Social Security numbers, and unless they go to the ER because they spleen hanging out, they're not getting Medicaid. It doesn't happen. I mean, if you make a decent salary, you don't qualify for Medicaid. So this is ridiculous, but this is what they do.